Welcome back. In today's session, we will discuss a homeopathic remedy called Passiflora incarnata. Introduction. The common name to Passiflora incarnata is the passion flower. It belongs to the family Passifloraceae. Prover is Dr. Hale. Passiflora is an efficient antispasmodic remedy. It is an efficient antispasmodic remedy of our Materia medica. It is very useful in cases of convulsions in children. You can see it is useful in convulsions in children. As it is an antispasmodic remedy, it is indicated in convulsions. Trismus, that is nothing but the lockjaw. Okay, lockjaw. And we have chorea, involuntary movements, and other spasmodic affections. It is indicated in cholera infantum with restlessness, excitement, and spasms. Neuralgias, internal and external of the limbs. So it is also indicated in the neuralgia, internal as well as external of the limbs. Okay, limbs, internal as well as the external neuralgias of the limbs. So guys, it's clear. It is an antispasmodic remedy. It is indicated in convulsions, trismus, chorea, spasmodic affections. In cases of cholera infantum, it is associated with restlessness, excitement, spasms, neuralgias, internal and external of the limbs. Clinically, it is also needed in delirium tremens. We see the alcohol withdrawal syndrome is nothing but the delirium tremens, where we have withdrawal symptoms like tremors, anxiety, palpitation, diaphoresis. Then GI upset could be there. If these symptoms are found, that is delirium tremens, passiflora has been indicated. It is also used in respiratory complaints like whooping cough and asthma. Hysteria. Okay, hysteria, wherein there is exaggerated emotional responses. Puerperal convulsions. So we know the puerperal period after the delivery. During the puerperium, if the mother throws convulsions, then passiflora can be thought of. We have neuralgia and worm fever. These are the clinical indications of passiflora. What are those? We have delirium tremens, respiratory, whooping cough, asthma. So we have nerve affections like convulsions, nervous affections. We have convulsions, puerperal convulsions, neuralgias, and worm fever. Sleep. Passiflora has a quieting effect on the nervous system. It is inducing the normal sleep in those individuals who have insomnia or sleeplessness. Passiflora will produce normal sleep in them. So, it is frequently given for the cases of insomnia. There is restless and wakeful sleep, especially in the feeble, infants, and the aged people with a history of mental worry and overwork. So, guys, we see in the people who have a history of overwork, okay, too much of mental strain, overwork, and then this is leading to sleeplessness. They have wakeful sleep, okay, they have wakeful. Even if they sleep, they will sleep only for a short period, that is a cat nap sleep, and they'll wake up very quickly soon after a short sleep. So that is, they have a wakeful sleep. They keep waking up in the between. So especially in the infants, in the aged people who have a history of mental worry and overwork. So this aged people who have mental worries and overwork, and it is also indicated in infants who are very restless and they are wakeful during the sleep. Many cases of convulsions, epilepsy, insomnia have been reported to cured with this medicine in massive doses. So guys, lastly we see that it is indicated in convulsions, epilepsy, insomnia, and Passiflora has found to be curing these cases when it is given in massive doses. So the dose could vary from 10 drops to 1 gram of tincture according to the age of the patient we will prescribe. We also have acute mania, and the atonic condition, generally it is present. Okay, the atonicity, the tone is lost. Atonic condition, the tone has been diminished, it is lost. So we see the atonicity all over the body is generally present. Now moving on to the few particulars. This remedy is not well proved, so we have very few particulars. Let us begin with head symptoms. There is violent ache as if the top of the head would come off. You can see in the picture here, the patient has a violent head. He feels as if the top of the head would come out. Okay, it feels as if it is going to come out. And also the eyes will feel as if they are pushed out. You see, eyes felt as if they are pushed out. The eyes will feel as if they have been pushed out, and the head, it feels as if it is going to come out, especially the top of the head. These are the symptoms. Moving further to the stomach, there is laden dead feeling after and between meals. So we see a deadly feeling after and also between the meals. It is associated with flatulence and sour eructations. We also have eructations. The eructations are sour. Okay, the eructations are sour, and we have flatulence. Along with the flatulence, dead feeling between and after meals. Clear guys? Sleep we have already discussed. Let us add on few more points. They are restless, they are wakeful, which is resulting from mental exhaustion, mental worries, overwork. It is seen in feeble infants and the aged. We also have the insomnia of the infants, the aged people who are mentally worried, overworked. They show a tendency to convulsions. It is also indicated in the nocturnal cough. So we have already studied in the guiding symptoms. It's just a repetition here, a revision. In the sleep of Passiflora, if they ask the sleep of Passiflora, it is indicated in insomnia. There is sleeplessness, or there is a wakeful sleep in the feeble infants, in the aged people who are who are mentally worried, they are overworked, they have a tendency to convulsions. It is also indicated in nocturnal cough, the cough which is excited when the patient goes to bed. So with this we come to an end of Passiflora incarnata. It is a very short remedy, yet very useful in our clinical practice. So I hope everything is clear, and if you like the video, hit the like button and subscribe.